Type 2 diabetes is a disease that affects millions of Americans. It's a serious condition that can lead to complications like heart disease, stroke, and blindness. But what exactly is type 2 diabetes? In this video, we will explore the basics of type 2 diabetes. We'll discuss what it is, how it develops, and how it's treated. By the end, you should better understand this condition and what you can do to manage it. What is type 2 diabetes? According to the Centers for Disease Control and Prevention, CDC, type 2 diabetes is a chronic condition affecting how your body metabolizes sugar. With type 2 diabetes, your body either resists the effects of insulin, a hormone that regulates the movement of sugar into your cells, or doesn't produce enough insulin to maintain an average glucose level. Type 2 diabetes is the most common form of diabetes. It usually occurs in adults, but children and adolescents are increasingly diagnosed with type 2 diabetes. People with type 2 diabetes have a higher risk of developing heart disease, stroke, and kidney disease. There are two main types of type 2 diabetes. Insulin resistance occurs when your cells resist the effects of insulin. As a result, your pancreas has to produce more insulin to help sugar move into your cells. Beta cell dysfunction occurs when your pancreas doesn't produce enough insulin. Without enough insulin, sugar can't move into your cells and builds up in your blood. You can develop type 2 diabetes if you have one or more of the following risk factors: obesity, family history of diabetes, impaired glucose tolerance, physical inactivity, African American, Hispanic/Latino American, American Indian, or Alaska Native heritage. Polycystic ovary syndrome. The different types of type 2 diabetes. There are 4 different types of type 2 diabetes, and each type has its own set of causes and treatments. 1. Type 2A diabetes is caused by genetic and lifestyle factors. This type of diabetes can be treated with lifestyle changes, such as diet, exercise, and medication. 2. Genetic and environmental factors cause type 2B diabetes. This type of diabetes can be treated with lifestyle changes, such as diet, exercise, and medication. 3. Genetic and medical conditions cause type 2C diabetes. This type of diabetes can be treated with medication. 4. Gestational diabetes mellitus, GDM, is a form of type 2 diabetes that occurs during pregnancy. GDM can be treated with diet, exercise, and medication. The causes of type 2 diabetes. There are many different factors that can contribute to the development of type 2 diabetes. One of the most important is weight. People who are overweight or obese are much more likely to develop the condition than those who are healthy. Other risk factors include age, family history, and ethnicity. African Americans, Native Americans, and Hispanics are at increased risk for developing type 2 diabetes. In type 2 diabetes, the body does not respond appropriately to insulin. Insulin is a hormone that helps to control blood sugar levels. When there is too much sugar in the blood, it can lead to severe health problems. Over time, high blood sugar levels can damage the nerves and blood vessels, which can lead to heart disease, stroke, and kidney failure. Several different things can cause the body to become resistant to insulin. One of the most common is being overweight or obese. When there is too much fat in the body, it makes it difficult for insulin to work properly. Other causes include age, family history, medications, and health conditions such as polycystic ovarian syndrome, PCOS. The risk factors for type 2 diabetes. There are several risk factors for type 2 diabetes, some of which can be controlled and others that cannot. Controllable risk factors include obesity, high blood pressure, and high cholesterol. Those with a family history of diabetes or who are over the age of 45 are also at an increased risk. A number of lifestyle choices can increase your chances of developing type 2 diabetes, such as smoking, drinking excessive amounts of alcohol, and leading a sedentary lifestyle. While you may not be able to control all of the risk factors for type 2 diabetes, you can significantly reduce your chances of developing this serious condition by making healthy choices and managing the controllable risk factors. Symptoms of type 2 diabetes. Several symptoms are associated with type 2 diabetes and can differ from person to person. Some people may experience no symptoms at all, while others may experience one or more of the following: increased thirst or hunger, frequent urination, weight loss, fatigue, blurry vision, slow healing, cuts and bruises, numbness or tingling in hands or feet. If you are experiencing any of these symptoms, you must speak with your doctor as soon as possible. They can confirm whether or not you have diabetes and help you develop a treatment plan. Diagnosing type 2 diabetes. There are a few different ways to diagnose type 2 diabetes. The most common and reliable way is through a fasting blood sugar test. You will fast for at least 8 hours for this test before having your blood drawn. If your fasting blood sugar is above 126 milligrams per deciliter, you have diabetes. Another way to diagnose diabetes is through an A1C test. This test measures your average blood sugar level over the past 3 months. If your A1C is above 6.5%, you have diabetes. If you have symptoms of diabetes, increased thirst, urination, and hunger, fatigue, blurred vision, slow healing wounds, your doctor may also do an oral glucose tolerance test. For this test, you will drink a sugary liquid and then have your blood sugar levels checked every hour for the next 3 hours. If your blood sugar levels are consistently high during this time period, you have diabetes. If you are diagnosed with type 2 diabetes, it is important to meet with the registered dietitian or certified diabetes educator to develop a meal plan that fits your needs and lifestyle. You will also likely need to start taking medication to help control your blood sugar levels. Treating type 2 diabetes. Type 2 diabetes is the most common form of diabetes, accounting for 90 to 95% of all diagnosed cases in the United States. In type 2 diabetes, your pancreas still produces insulin, but either your body doesn't produce enough of it or the cells are resistant to its effects. As a result, glucose can't be moved from your blood into your cells, where it's needed for energy. There is no one-size-fits-all approach to managing type 2 diabetes. The best way to manage your diabetes is to work with your healthcare team to create a treatment plan that works for you. Your healthcare team will likely recommend a combination of lifestyle changes and medication to help you manage your blood sugar levels. Some common medications used to treat type 2 diabetes include metformin. This medication helps to lower blood sugar by improving the way your body responds to insulin. It is usually the first medication prescribed for type 2 diabetes. Sulfonylureas. These medications help to stimulate the pancreas to produce more insulin. They are typically used in combination with metformin. Phytazolidinediones, TZDs. These medications help improve insulin sensitivity in your cells, making it easier for glucose to be absorbed into them. TZDs can cause weight gain and fluid retention, so they are typically used in combination with other medications. Insulin. If diet and lifestyle changes alone prevention of type 2 diabetes. Type 2 diabetes is preventable through a variety of means. Lifestyle changes, such as maintaining a healthy weight, eating a balanced diet, and exercising regularly, can all help to prevent the development of type 2 diabetes. In addition, certain medications, such as metformin, may be prescribed for those at high risk for developing the condition. Making lifestyle changes is often the first step in preventing type 2 diabetes. Maintaining a healthy weight is crucial, as obesity is one of the leading risk factors for developing the condition. Eating a balanced diet that includes plenty of fruits, vegetables, and whole grains is also important. In addition, regular exercise helps to keep blood sugar levels in check and can prevent the development of insulin resistance, another key factor in type 2 diabetes. For those who are at high risk for developing type 2 diabetes, medications such as metformin may be prescribed. Metformin works by helping to regulate blood sugar levels and can often help to prevent the condition from developing. Conclusion. Type 2 diabetes is a severe condition that can lead to health complications if left untreated. However, with the proper knowledge and treatment plan, people with type 2 diabetes can manage their condition and live long, healthy lives. We hope this article has helped you better understand type 2 diabetes and how it can be managed. If you or someone you know has been diagnosed with type 2 diabetes, don't hesitate to contact a healthcare professional for treatment options.